Hello and welcome to Conversations on NTA Network, a program where we talk about everything under the sun. We talk about issues that affect you and me. We have a lot of people in the house, or three. I'll leave them to introduce themselves, starting with the lady right in front of me.
Okay, thank you for having us. My name is Chika Opolisa. I'm the founder of Brain and Spine Foundation.
Okay.
Hello Nigerians, my name is Douglas Emeka Oko. I'm a consultant neurosurgeon, which means I'm a brain and spine surgeon. And it's nice to be here with you, Nike, Hawa, and Chika.
Hello, I'm Hawa Mahmoud. I'm a student and housewife, actually. I'm happy to be here with you all.
Welcome, everyone. We're going to be talking about self-medication, which I think a lot of us fall under the definition of self-medication. Maybe the doctor will give us some proper definitions about what that truly is. But before that, we'll take a break and we'll be right back after this here on Conversations.
I don't think in gender boxes at all. I just get on with it.
A man that would dare to ask the wife, who do you think you are? That is a real man.
In fact, our husbands are our firstborns. The husband needs more attention than even the children.
It's not only about work, it's not only about family. They need to take the time to look after themselves, and we don't do that.
They took my money, I paid every fees. I never asked to be hoisted as a governor. I wanted to be allowed to go out there and contest for the position of governorship candidate first.
There's nothing greater than looking back and seeing that while you were aspiring, you were able to inspire others.
Power to women. Yes, we need to have more women, multitaskers around Nigeria to get Nigeria working.
Definitely.
Okay, we're back. Self-medication in the conversation room. That's what we're talking about. Dr. Douglas, what is self-medication?
Nikki, just call me Douglas.
Okay, Douglas.
Forget the doctor thing. Basically, the key words to talk about here are drug abuse and then drug misuse.
Yeah.
The drug misuse tends towards more of the self-medication that you talk about, Nikki.
Okay.
Drug abuse is basically when you have individuals actually taking medication or substances, chemicals that are not prescribed or that they don't have any guidance in terms of taking those drugs, and they're usually taking the drugs for specific kind of effects.
Okay.
And that'll make them, the average word, the key word I'll use is high, basically.
Yes.
Drug misuse, on the other hand, is just taking drugs to try and get some sort of relief from some sort of symptoms that people have. And that's where the self-medication comes about. It's a key issue, or quite a worrying issue in a place like Nigeria, because one of the fundamental issues that we do have is regulation of within the healthcare space. Yes. Basically, and then basically, and I'm sure as the conversation goes on, we'll touch on some of those issues and why things like self-medication is really rampant in Nigeria. Nigerian healthcare space.
Yeah, I, in my own case, self-medication, I mean, just before that time of the month, and I'm sure the ladies know what it is, when you feel your body is starting to, it's, for some of us, we just, before the pain hits, we just quickly pop 1 or 2 Panadol or anything, well, let me not call brands, paracetamol, and take that just to ebb away the pain. Would you call that self-medication or just me being careful? Because if I was to go to the doctor will give me paracetamol. So why don't I just take the paracetamol when I already know what to take?
I think the key thing, Nika, is that there are different classes of drugs. Okay, they are what they call the over-the-counter drugs. Okay, simple drugs where you have some sort of simple symptoms and then you take those drugs. You don't need prescription for those drugs. Okay. So some of the drugs that you talk about actually fall within that sphere of over-the-counter drugs. So like the paracetamols you talk about, the ibuprofens and stuff like that. So they fall within it. There are other drugs that should be prescription drugs. Okay, for example, the antibiotics, the sedatives, things like diazepam, for example. Okay. Other drugs are actually more complex, and when you look at their adverse effect profile or the possibility of them causing side effects, if you're not taking them very well following a prescription or following the guidance from a healthcare professional who knows what he's doing and can give you guidance.
Okay.
So there are different classes of drugs.
Okay. Howard, do you have any self-medication stories so far, or you're the kind of person that goes straight to the doctor if you or your children fall
Actually,
ill?
we are all victims. Once in a while, you know, just like some few days back, I was having some pains. Actually, I'm suspecting ulcer, so usually I have Gestid at home.
Okay.
Anytime I feel I'm uncomfortable, that pains, and you know, I'll just take Gestid. Not knowing that it's something that is much more serious that I am expecting.
Okay.
When I went to the doctor, we have to, you know, do the endoscopy, and the result was somehow, you know.
Okay.
So
You needed
it's
something a
really,
bit
yes,
more.
I was really suppressing the sickness, not treating it. So the doctor advised and gave me some drugs
Yeah,
after
you're even
the
lucky you're in a
consultation.
position
Yeah.
where, you know, something
Yes.
could be done
Yeah.
and all that. Chika, you want to tell us about your foundation and the kind of work that you do?
My foundation is, like I said earlier, it's called Brain and Spine Foundation.
Okay.
Yeah, we create awareness of neurological disorders, brain and spine especially, because, you know, brain and spine is like the engine of our body. So many people are falling victims. So many families have been affected every day without knowing what is killing their loved ones. So many people, as I speak, people are falling. People are being affected by brain disorders especially, and they are not aware. Like you spoke about headache. Headache, for example, there are so many types of headache, but only few people are aware that some headaches are not just ordinary headache. Okay, so we are creating awareness, especially on these disorders, and the fundamental, the lying factor, it's on this. I'm missing something out.
Sorry then.
Can we cut off?
Yeah, you can start again. Don't worry, just
Okay.
start fresh.
So we are trying to create awareness of all these headaches, that some of the headaches are potential dangers, some
Okay.
are red flags
Okay.
to something that might be fatal to your life. Okay, so we try to let Nigerians know, let Africans know that these things are there, these things are happening, and people are not aware.
Okay, so you try and encourage us to go see the professionals. When you say you raise awareness, I mean, when you tell us about the headaches, you tell us about the different types, and then if you see these symptoms, go and see your doctor, or is that the kind of thing you do, or what else?
Yeah, what we do first of all is create awareness, educate people, inform them of all these things that are happening. People are not aware of things like brain aneurysm, brain AVM,
Yeah.
brain tumors. So many people have consistent headache for a very long time, but they don't know that they have to see a neurologist, that they have to get a CT scan, they have to get a test, MRI of their brain, to find out what is actually wrong, and then take a very proper care of themselves first before something bad happens.
Okay, so tell me about the interest. How did you start the foundation? Is there a story behind it?
Yes. My younger sister, Victoria,
Okay.
suddenly had a severe headache while she was sleeping. And before we could, say Jack Robinson, she had collapsed. And that was the starting point of this whole journey.
Okay.
And then she has had some major surgeries, 3 in Nigeria, 2 abroad. And she has recovered, not too well, but that is what led to this foundation.
Okay.
Yes.
Was there an injury before that she just collapsed? There was no prior
No,
sign
there was
or
no
symptom?
prior. No, there was no prior symptom. There was no sign.
Wow.
It just happened that she just went to bed, and all of a sudden she woke up.
Okay.
And then before you knew it, she collapsed, and then
Okay.
she slipped into coma, and then the rest is history.
Yeah.
Yeah.
That just goes to show that sometimes when you need to actually get yourself checked even regularly. Dr. Doug, for people that are just joining us, he's a doctor, even though he says I shouldn't call him doctor. To be honest, I didn't know there were that many people like you in Nigeria. I really thought that, neurosurgeons, if you really want to see a neurosurgeon, you probably have to start sending emails to the UK or to India and things like that. I didn't know that there were that many people in your line of work. So do you have a lot of people coming in to say, I feel, I need to, in other words, have my head checked? Do you have people doing that a lot?
Okay, so Nike, first of all, you're absolutely right. There are very few neurosurgeons in Nigeria. Presently, the count is somewhere between 65 to 70. It's still quite suboptimal, 65 to 70.
In the entire country?
In the whole of Nigeria, so it's still quite suboptimal.
Wow.
Before I go to answer your question, I'd like to actually educate Nigerians about one of the things that Hawa talked about. When she said that she did an endoscopy, it actually meant that they put a camera down her throat into her tummy, to actually look into her tummy. So there are places in Nigeria that have the capacity to deliver such complex care. So it's important that Nigerians know that.
Okay.
Absolutely very true that you've heard from Chika, the story with her sister and having such sort of catastrophic presentations, clinical presentations of the patient.
Yes.
Okay. There are two organs in the body that can be very unforgiving and that can cause sudden death. Okay. And those two organs are the brain and the heart. Okay. In Chika's sister's case, Victoria's case, it was she had a bleed into the brain. Okay, from nowhere, bang, a bleed into the brain. Also, the same thing with the heart as well. You can have some sort of stroke of the heart or a blockage of the blood vessel to the heart, and the patient has a cardiac arrest, or the other word, a heart attack. Okay. So brain and heart, key organs, and then they can cause sudden death. Okay. So the key issue of advocacy and providing information, empowering the average Nigerian with information about symptoms, signs of these kind of things is absolutely important. And I give NTA a big thumbs up for actually creating such a platform for us to have this sort of conversation about all this.
Yeah.
So yes, you can have people, they look very alive, there's no problem with them at all, and all of a sudden they drop down, and it is not the witches from their village.
But how can I have a brain bleed when I didn't hit my head? I didn't injure my...
Absolutely, yes.
I understand with the heart attack, it's maybe accumulation of fat or whatever in your system, and it clots the artery. But in the case of a brain bleed, I've always had that impression that it's due to some trauma in the
Absolutely no. So probably where you're driving.
Like for example.
Where you're driving to, Nika, where you're driving to, Nika, is what can cause this.
Yes.
That's probably where you're driving to.
Yes.
So one of the things we talk about etiological factors or causative factors. Okay. Key thing, and that's where prevention comes in. Key things are smoking, high blood pressure.
Okay.
There are some key medical conditions that can run in families that can predispose people to having some of these problems as well.
Okay.
In Chika's sister's case, for example, Victoria's case, she had probably had that condition since she was born. The word we use is congenital.
Yes.
So she had what we call an AVM for short, or an arteriovenous malformation, which basically means that the high pressure blood vessel coming from the heart, the artery, is in direct communication with the low pressure blood vessel taking blood back to the heart. Normally, you have capillaries in between dampening the pressure from the high pressure one before it goes into the veins, but you have a direct communication. The veins are not usually used to high pressure blood, but because high pressure blood is coming straight into it, what happens? It ruptures and it bleeds. Okay. Other causes of a bleed are high blood pressure. In people who have sustained high blood pressure that is not well controlled over a long period of time, their blood vessels can become not very elastic or inelastic. Okay, and because they are too hard, okay, or not pliable enough, not elastic enough, high pressure can rupture them and they can bleed. Okay. The other major cause of a bleed into the brain is an aneurysm. An aneurysm is a weak spot on the blood vessel. It's like a ballooning out or an outpouching of a particular part of the blood vessel. And for aneurysm also, the predisposing factors are smoking and high blood pressure. So Nigerians, smoking, please. Okay. Problem with an aneurysm is an aneurysm ruptures, half of a third of people don't even make it to hospital. So again, person drops down dead, was very well. It is not the witches from the village or the enemies. Nope. And one of the things that's happening over the last 10 years is because the capacity to actually do scans, do investigations to pick these things up has actually improved over the last 10 years. So we're not picking these things up more than before. Previously, people used to say, oh, this kind of things don't happen in Nigeria. Oh, it's happening.
So I can get an MRI or a CT scan done here
in Nigeria.
And it will be of the same
quality.
That's what I was getting to. Is it at the same quality as if I go and do it in Ghana or anywhere else?
Absolutely.
And they will pick it.
Absolutely.
Okay, so if hypothetically I do it and they find a weakening of a vessel and everything, then what do I do? Where do I go from there?
It depends on how a patient is presenting. Okay. So one of the key things, one of the key messages that Chika pushes out is about these headaches.
Yes.
Headaches. We will all have headaches now and again. Yes. Tension headaches. Okay, you're stressed up or tension headaches. Usually headaches are around there, or usually you take paracetamol or something before the next day or something, it's gone. Okay. But if you have headaches where you're feeling nauseous, the headaches is lasting 2 weeks, 3 weeks, you're having some other features with it. It's not like your normal everyday headache. You should get checked out. You should see a healthcare professional, a doctor, or somebody who knows what he's doing. And also, this is one key thing, is that the other healthcare professionals should be empowering information to know that we have people who have the capacity in Nigeria, not just in terms of the skill, but in terms of the hardware, the equipment and stuff to actually deal with people who actually have this kind of complex problem. So if a patient, for example, has headaches for 3-4 weeks, goes to a particular doctor, and the doctor says, I'm also worried about these headaches. Maybe we should check the back of your eyes. Maybe we need to get an eye doctor to see you to check the back of your eyes. Or maybe we need to get a scan for you. And they actually find something on the scan, they should refer that patient to a neurologist or neurosurgeon, depending on what they actually find on the scan.
But if I have a headache that's lasted a week and they give me, the doctor prescribes something strong, and it ebbs away for a while, it might not come back. So, I mean, this is the whole self-medication thing. If it worked for me and then next week she's like, man, I have a headache and it's really disturbing me, it's lasted a week, I'm like, come and take what the doctor, which is what happens in Nigerian settings a lot, you you call someone and say, what did you use that time that you said your headache was severe? What did you use? And the person just goes ahead to buy it. We had that problem time and again.
And the thing is, it's not surprising why we have that problem. There are specific reasons why we do have that problem. Number one, the Nigerian healthcare system over the last 40-50 years has failed the Nigerians. Have you been into a public hospital recently, taking a family relative? Do you know what the patient journey is like? Okay, you can ask Chika. Chika probably has had cause to actually take family to hospitals. The patient journey is stressful. The patient journey is stressful in terms of when you look at there's what it will take for the patient's family, the patient himself to go through the difficulties in the hospital. You'd rather go to the chemist and take a drug.
And doctor, if I may ask, the headache, is it a full headache or is it from the forehead, from the back of the head?
I think the key thing is, if you have a headache that is a tension headache or a headache that is from stress, generally you will know. You will know yourself because all through the time
let me say something. I think I'm down now. First of all, I just want to say that my Brain and Spine Foundation, we advocate for early medical checks before any complications arises, and we create awareness. Just give information on all these neurological disorders. Coming to my sister case happened, and luckily I was there, and I'm someone that doesn't take chances. So when it happened, I had already assessed the situation, and that was not the time to start giving any medication on my own. So the first thing I had to do was just to rush her to the hospital that night. And it now happened that she bled, just like doctor said. She had a bleeding, and then the doctor later told me that she had what is called arteriovenous malformation, and that was a congenital case most of the times. That means she was born with it. And along the line, she was in coma already, and that lasted for like 8 days. And the surgery took place much later by a neurosurgeon. After then, there was an infection after the third surgery, which was meant to be the last. But after then, she wasn't okay because of the infection, and she had to be flown abroad. Thank God she's back in Nigeria, she's good. Then coming to self-medication, first of all, I would say that when things happen, when an illness or an injury just occur, I think the first thing for the person to do is to assess the severity of the illness. Is this something that you can manage maybe by just first aid, taking any painkillers, over-the-counter painkiller? Is this something that maybe when you rest, you can get yourself? Is this something that may be caused by dehydration? Is this something that's caused by anxiety or stress? So all those things are factors that you have to look into first and determine whether it is right or it is wise for you to maybe take any drug, because all of us are really guilty of self-medication. I am guilty too, but at least for some time now, I have shifted to natural remedies.
Okay.
Instead of doing any, just over-the-counter drug or painkillers. So I would rather do my massage, maybe do my green vegetables, maybe take fruits, and then, rest and ensure that I get enough sleep. So these things are things that I have done over the years, and it is working for me.
Okay.
Doctor, you didn't answer, as in that symptoms of the headache. Sometimes the headache is from the forehead, sometimes from the back, sometimes it's like the head is heavy somehow.
So what I was trying to say, Hawa, is you yourself, you will know what the general headaches that you have when you're stressed up. Okay. Or when you have things going on with you, maybe some difficulties, you will know what a normal stressful headache is. Okay. Anything that's out of that in terms of your experience with a particular symptom, you yourself, you will know as well that, normally if I'm stressed and I have headaches, okay, maybe I feel the headaches here or maybe in the temple. Usually it's around the temple region for the stress headaches, but you can feel it there as well. Okay. Some people, when they have malaria and had some other kind of feverish conditions, they have headaches as well. Okay. But what I'm saying is that the headache is now slightly different in terms of the intensity, in terms of the frequency, or in terms of how long it's lasting. In terms of if you're having other symptoms, you're having double vision, you're feeling nauseous, you're not seeing very clearly and stuff like that, and it's lasting a long time. You have to, whenever any symptom starts worrying you a little bit, that, this is not what
it's not ordinary.
Yes, this is not ordinary. Immediately, you should be going to see a healthcare professional, a doctor. Immediately. Okay. Now, there are different classes of symptoms as well. There are symptoms that are just dragging there, and then it gets to a point you're worried. Okay. And there are symptoms and features that immediately tell you that this is an emergency. Okay. Someone drops down. Someone is complaining, I have chest pain. I can't breathe. That is an emergency.
Yes.
There's no two ways about it. That is so clear. An emergency, you move straight to a healthcare facility that has capacity to look, because it is not all healthcare facilities that have the capacity to look after people who are in trouble. And Chika has a story about that as well.
Yes.
With regards to her sister. Okay, you have what we call the primary level care, secondary level care, and tertiary level care. Primary level care is mainly for, you have hypertension, diabetes. We're just looking at all the drugs you're taking and making sure your blood pressure, your blood sugar is okay. And we are giving you immunization. You have malaria. We can test you for malaria. That's primary level care. Simple, straightforward, looking after the everyday public. Okay. The secondary level care is where you're getting to the point where we need to do surgery. You have appendectomy. The endoscopy, for example. That's more of secondary level care. Then there's tertiary level care, where you're talking about brain and spine surgery, about heart surgery and stuff like that. So there are different levels of care.
Yes.
Okay. And usually emergency care will fall somewhere towards secondary level and tertiary level care. Okay. So what is an emergency? Is an emergency. I'll go back again, Nika, to talk about the over-the-counter drugs. Okay. There's nothing majorly wrong with you having a headache. I'm stressed up. Let me take some paracetamol. There's nothing wrong with that. Let me take some ibuprofen and stuff like that. Now, if that symptom is persisting and is going out of what you would normally consider, this is just normal headache and stuff like that, I think it's time for you to now say, hey, leave the over-the-counter drugs. I think I need to be seeing somebody who can give me guidance and who can look and assess me properly. So when you ask me, is the headache here or is the headache here? Well, I don't think I should answer that question directly. All I should say is that if you're concerned about any headache, go see a proper a person, healthcare professional, and the person will assess you and assess you properly.
No, somebody like me, actually, when I'm always stressed off, I have headaches, so I know that my own is
to me, that doesn't sound worrying. If you were telling me that, normally previously you used to have headaches, and then by the time you take paracetamol, you rest very well, you drink lots of water and stuff like that, you feel better. But now, over the last 3 weeks, your headaches are not getting better. Now, this eye is doing one kind, and you feel a little bit nonsense. The headache wakes you up in the night. I'll tell you,
something is wrong somewhere.
Go see a doctor to check this out.
How affordable are CT scans in Nigeria?
Let me put it this way. So you've had private healthcare providers in the last 10 years in Nigeria who have really taken the game to the next level when it comes to providing complex tertiary care. You see the words I use? Yes. Complex tertiary care. So the kind of care that people go to Germany, UK, US for. Okay? So these private healthcare providers are trailblazers. They've done fantastically well. But when you look at the 3 A's of healthcare, when you talk about availability, affordability, and accessibility of healthcare, okay, in the short term, they've only been able to provide availability. And there's a reason why. Complex healthcare is expensive everywhere in the world. And unfortunately, nobody says, let me save my money for when I'm going to, my aneurysm is going to bleed. Nobody does that.
Yeah.
Okay? But when you look at other clients, like places like the US and the UK, especially the UK where you have the NHS, because I'm actually trained in the UK.
Okay.
The NHS, okay, you see that they pool funds together and healthcare is free at the point of assessing it.
Yes.
That doesn't mean that somebody pays for it. I know how much I was paying for my national insurance when I was in the UK. Okay? Almost 1/4 of the salary that I paid was going to national insurance. That's big money. Okay? Now we might talk about the national health insurance and whether that can cover complex delivering complex or covering complex healthcare issues in Nigeria. Of course, forgive my French, the NHS at this particular point that we're speaking about is a joke, okay, and it needs to be seriously looked at if we're actually going to start providing proper healthcare for Nigerians. Other issue, Nike, is that healthcare is not a major priority for our politicians or our leaders or our big people in Nigeria.
But it should be.
It should be. There's a question of value for human life. Okay? In the UK, for example, if a child comes into a hospital and it's going to take £1 million to make that child okay, they will spend £1 million because every life counts. When are we going to get there in Nigeria? Well, wow, it's a long way on. But programs like this and continue to push the advocacy and all the fantastic work that Chika Okolisa is doing is what needs to be done.
Yeah.
Actually, we need to, have more of people like Sister Chike in educating and informing people on such cases, so that it will reduce the level. Then when you talk about this drug abuse, this, it has been a big story in Nigeria these days that people abuse drugs. In fact, yes. These things are also part of the problem. It's as you just said, drug abuse and hypertension are major causes of then definitely we need more education so that at least it will reach everybody in his own zone.
Yeah.
Yes.
For Douglas, I'm curious to know that between a healthy brain and someone who has abused medication, for instance, the tramadol and codeine users long term, do you see any differences when you observe or when you compare their brains? Is there...
I think the first thing I'll say, Howard just actually reminded me of something. We're talking about the causes of a bleed into the brain, for example. Okay, so there are actually some medications that are actually abused that can actually cause a bleed into the brain as well. Cocaine, we all know coke.
Yes.
Okay, and the ones they call the amphetamines. Okay, they can actually cause a bleed into the brain. So one of the things that we do, especially when we see young people coming in, is a bleed into the brain. We actually do what we call toxicology to actually look at, check their blood for if they're actually abusing particular drugs and all that. So, especially when you talk, there are different classes of drugs that people abuse. There are what they call the opiates. Okay, they are painkillers, very strong painkillers, things like the codeines, the tramadol, oxycodone, morphine, big names. But they are painkillers used, especially for secondary and tertiary care as well. They're used at that level of care. And there are drugs like what they call the sedatives, diazepams, the benzodiazepines, things like midazolam, and stuff like propofol. Remember Michael Jackson's propofol?
Of course.
Okay. There are other drugs as well. I mentioned some of them. The ones that make you really, really high, the heroin, the cocaine, the amphetamine. The ones that really, really affect the brain are the things like the amphetamines, the cocaine, the heroin. Those are the ones that can really affect the brain. Now, what do they do to the brain? They kill the brain cells in such a way that if you were to look at it, if you were to compare two people, maybe a 40-something-year-old gentleman or lady and another 47-year-old, that one takes this kind of drugs, this one doesn't take this kind of drugs. If you compare both of them, you have the one who takes the drugs will have more memory problems. And actually, when you actually do brain scans or actually operating on such a patient, you find out that the brain is shrunken, more shrunken compared to the other person's brain. Okay, so the issues of cognitive or the sharp brain, where their intellect and stuff like that, the issues of memory and all that can actually be affected by some of these really complex hard medication, things like the amphetamine, the cocaines, and the heroin as well.
Okay. I think I have a question here. Just like her sister's case, she was born with it. Then is there any way, any symptoms that we can notice from childhood or something?
Unfortunately not. Unfortunately not. Unfortunately, that's the problem with it. And that's why when you look at some of the issues within, for example, providing brain and spine surgery care, for example, especially for complex brain care, there's always the issue of secondary prevention.
Okay.
Keyword: secondary prevention. Primary prevention is, listen, don't smoke. Make sure you're the appropriate weight. Don't eat too much calories. Make sure you control your food. Do exercises. That's primary prevention. You're trying to stop it from happening in the first place. Okay, then the secondary prevention. You already have high blood pressure. You already have diabetes. Are you managing it properly? Are you going to see a physician, a doctor, a healthcare professional, who is actually managing, who is actually monitoring all the key indices, your blood pressure, your blood sugar and all that? That's key in terms of secondary prevention. Then also, if a patient actually presents and has had a bleed, has this or has something happening with the brain or the heart or any particular part of the body, is the person accessing care on time to prevent further complications? That's also secondary prevention as well, to prevent further complications. And especially with the kind of work I do, time is very critical.
Yes, of course.
Buhari's son on my mind. Okay, anything that has to do with the brain, and there's a specific reason why. The brain, the spinal cord, and the nerves, they are all permanent tissue. They hardly regenerate. If you cut your skin, it heals up very nicely. The brain and spinal cord, they hardly heal up. They are very unforgiving.
Okay. I didn't know that.
Yeah, they're very unforgiving.
I've never heard of that.
Usually, if a patient has a primary brain injury, either from, you talked about trauma, having an accident, an industrial accident, or riding a bicycle like the president's son, a motorbike, for example, you have a primary injury like that. The primary injury has happened already. Everything you do from there is to prevent secondary injury. Remember secondary prevention? Okay, because there are other injuries that can cascade from there. Okay, so our job as specialists with all our team and everything is to provide care in such a way that we prevent the secondary injury and hope that some improvement and some relief from the primary injury happens.
Okay. As you mentioned that Victoria's issue was a congenital issue. If you don't mind me asking, how old was she when this happened, when she collapsed?
Yeah, she was 28.
And throughout the 28 years, there was no sign or symptom that...
Actually, there was none, because even the particular day it happened, we jogged for more than 3 hours, two of us, jogged that Saturday morning. So she did not in any way show any sign of ill health. She was very, very, seemingly very, very okay until she went to bed and then suddenly was woken up by the bleed. I also want to put, aneurysm, for example, is caused by maybe smoking, alcohol, and maybe your lifestyle. But most of the times it also runs in the family. I have seen families that, the mom died of aneurysm, and the daughter also died of aneurysm, and that was the time the other daughter, had to now go and check. And unfortunately, she also had aneurysm, but before her own could bleed, she had already gotten help. And she also registered a foundation, but not in Nigeria. She's in Ghana. She also registered a foundation to also raise the awareness that aneurysm could also, be in the family. I also understand that because of the stigma that is associated with things that has to do with brain people don't have this courage or this boldness to talk about it when they're even aware that their loved ones, are being affected. So they hide it, because when they say that somebody or my brother has a brain problem, a brain disorder, they feel that people will start just stigmatizing. So they hide it. So I encourage people, when your brother or your mother or your relative is affected by these disorders, that we need to talk about it. People need to know that these things are there. Because when we don't talk about it, people are affected and they don't know. Just like yesterday, I was talking with somebody at NJC, at Supreme Court, and she was just telling me that last week, their security just was hit by brain aneurysm, and before they could get to the hospital, he was already dead in Abuja here, a young boy of 32 years. And that was how that life was gone. And so many people did not know what killed him. You know, so many of the people that come to the hospital, sometimes they don't get to hospital alive. So many of them, you know, just get there and they are confirmed dead. There was one that happened recently, that was few months ago. You know, he had a seizure or a bleed in the office, and before he could even get an assistant or help in the hospital, he had come to the hospital, but before they could even get to the theater, he had already had another seizure and died. And that was just recently too. So people are being affected every day, but because people are not talking about it, and because there is no, you know, there's no awareness at all, people die and nobody knows what kills the person. And people will always say, is this maybe it's a witch, it's arrow, it's an arrow, is my enemy. Do you understand?
I was even looking at it from that aspect. You know, Nigerians, we have this strong culture. We believe in so many spiritual things. The first thing they will say, that old woman is a witch. She's the one. She refused to die. She's killing everybody in the family.
If you go to, you know, during my hospital visits, I found out that when you go to maybe major hospitals, like National Hospital, Gwarimpa hospitals, most cases in the emergency, if they have 5 cases, there's sometimes 2 are these problems. Do you understand? But nobody hears about them, and most of them don't come out alive. And also one thing that our doctors do that is not good is most general practitioners, they don't diagnose this thing on time. They don't even want to refer a patient when they are aware that they are not going to handle this thing.
Do you know why?
They want to keep the patient and be doing trial and error most of the times.
Okay, I didn't see it as that. I was going to say, if you suggest to me, okay, why didn't you go do a CT scan? I'll be like, at how much now? I mean, I just came to say that, you know, my head is paining me, and they say I should go and do CT scan and spend X amount of money, because most of the times the doctors know that the patient they're going to complain about money.
If it's not a very serious case, they don't have option than to tell the person. It's not left for the person to know if he or she can afford it, or he will go and source for the money. Remember, we're talking about life.
Yes.
It's your life, and you know you have it once. There is no spare. So if you lose it once, you have lost it completely.
So you believe some doctors try and keep the patient with them a little longer?
Of course, like my sister, for example, when it happened, the first hospital we rushed to, she was there for 5 days. They had already told me that she had 1 to 2% chance of surviving. So they kept us, and they were counting the days. Every day, she was in ICU in oxygen. She was in coma, and they were waiting for us, just to get tired and ask them to remove the oxygen. So until the day I found out, on the 5th day, because they told me that a consultant was coming. And unfortunately, it was a general consultant. I asked them, since you don't have a solution for my sister, discharge us. And they thought I was crazy, and I meant it. It was around after 9 in the night. How could you discharge someone that was in ICU, in oxygen? So where are you taking her to? I said, I don't know. But one thing, you don't have a solution. It's better that I go look for a solution and she dies than wait for you. And then she goes. Okay, so that was how I left that night and started making calls until I got a help, who now called one neurosurgeon immediately and asked us to rush to his hospital. And that was how my sister's, just turning point started. And they evaluated her and examined and told us, not much to be done, because, she was still breathing, there was still pulse. But, it was already very, getting so late.
Wow.
Yeah, because even then I didn't know if she was alive or not. But the point is that we got to the hospital.
Wow.
And doctor came and said, there was still pulse. And that was how they started, just preparing her for surgery. And luckily, she was able to make it back to life.
You know what I've learned from what you've just told me, Chika, is that sometimes even when the doctor says, oh, there's a consultant coming, the consultant is coming on Wednesday, maybe you should ask for the consultant's number and speak to the person.
Yes, and also
or Google the name
and
or
also
something.
ask,
Because
and also ask
5 days.
Who is the consultant?
Okay.
Does he have anything to do with this ailment?
Wow.
Do you understand? Or the person that is coming, is there a way I will know even what is wrong with my relative? Is there you can Google, you can find information. At least thank God for Google today.
Yes.
Information is at the tip of our hands. So most of the times, just these things are there, but because so many people believe doctors' words are final.
Yes.
Okay, and so many people, have been affected, and they are just losing their loved ones. Why the solution is there, but it's just for them to have the information and then know the right thing to do and the right place to go and the right person to see. It's so important because so many of the times, we are just sitting in the hospital. The specialist that we are meant to see, we are not seeing the person. And the people there, they will refuse to discharge you because, number one, they want to keep you because, number one, you are paying for bed, you are paying for room, it's
especially the
first.
private hospitals.
Yes, but I advise patients, when I go for visits, I ask them, what is wrong? Have you seen somebody like this? The doctors that are coming.
We don't do that. We don't ask questions.
Is the person a specialist on this particular case? The person, and most of the time, the patients will say they don't know. I said you should know.
But the question is, are we empowered to ask questions?
Do you understand? Yeah, but we are.
Are we empowered?
We are empowered to
the
ask
truth is that
questions.
We actually are. There's a National Health Act.
We are empowered to ask questions, but we don't ask.
So Nigerians, there's a National Health Act.
Okay.
Okay. Part 3, Section 23. And every Nigerian should go read that.
Okay.
It tells you that every Nigerian who goes to see a healthcare professional must be provided with information about the diagnosis, about what kind of treatments you're giving, what kind of drugs, what kind of medicine. It is there. It is a standing law in Nigeria. Every Nigerian, it is your body. You're going to see a healthcare professional, they must tell you what they are doing for you, what the diagnosis is, what they are treating you for. They must tell you. And they must be able to tell you whether they have the capacity to handle
manage
it,
or
not. Okay?
See, I didn't know this.
Yes.
The key thing is this. Yes, people talk about change in Nigeria. Change does not come overnight. It comes when people rise up and say, okay, yes, we want change. Do you understand? You go to a hospital. Sometimes I tell even my relatives, oh, I went to the hospital and the doctor, they gave me a drug. I said, okay, what are they treating you for? Oh, I don't know. I say, why didn't you ask the doctor?
They don't. People don't know.
Even as educated as some of us are, we don't
if I visit like 10 patients in a day, 9, most of the times 10, they don't know what they are being treated for.
But this mentality.
Do you understand? Most of them don't know.
Nurses have and the hospital people, they have this attitude. When you ask questions, they throw back.
For example,
people are scared.
For example, there was a case
people are scared of asking. Yes.
Yeah, there's this case.
That you must put pressure.
This even happened to me.
I was like, there's this case that I just saw recently.
Okay.
The lady, her husband, had a stroke, and unfortunately for years, but because he has been having difficulty doing just getting access to physiotherapy because of no money, so the guy has suffered for all these years, still paralyzed. So the wife has been managing him, but recently he had a fall. He hit his head again, so he lost his memory again. He lost his speech. I saw them yesterday. Okay, yes, this young girl is suffering alone, but yesterday I was able to ask her, what are the medications? I know because where they are, I don't know whether they have access to a neurologist or a neurosurgery, because I understand what he is passing through.
Okay.
And I asked her, what are the medications that he's taking?
Given, yes.
He doesn't. Yeah, she doesn't know. But what she did was she just brought out the drugs that
and showed them.
And showed them to me. And I requested to see the doctor, that is managing it. And I went and I asked the doctor questions. If it comes that I have to maybe find assist or beg them. Sometimes I'm lucky. Some of these guys, like he said, neurology, is the lost stepchild of medicine. Everywhere is a very expensive treatment to make. Very expensive. Anything that has to do with brain it runs in millions to treat. It runs in millions. But I'm so glad with, just neurosurgeons like him and his team. Sometimes they will say it's not all about money, and I have seen it happen.
Yeah.
It's not all about money. Sometimes they will even tell me, let's get money for the theater park. Don't bother about surgery fee. Let's just, get the normal, medications, and then just this thing, just to save life. And that thing, it goes a long way to encourage, the work that I do. So most of the times, people need to really understand that it's not always about going to hospital. That is the case. Yes, hospitals are everywhere. Private, general, government. What capacity do they have? That's the most important thing. People are dying every day in hospitals. And doctors, the way they are trained, there's no emotion. They don't have emotion.
Yes.
Once, just once the head person passes, they will just cover the person and move over to the other person.
It depends. It depends. Let me explain that very clearly. Let me explain that very clearly. And it's important that all Nigerians know this. Number one, the doctor, the nurse, the physiotherapist, the pharmacist in Nigeria, they are Nigerians. So when you drive on the road in Nigeria, you see the way people drive. Or when you go to a restaurant or go to a fast food joint or go to an ice cream place and you see the way people actually provide service to you. Yes. Okay? I'm sure everybody's feeling what I'm saying.
Definitely.
So don't think that the doctor and the nurse in Nigeria, they will be acting and they will not say, oh no, we have chosen to be good. You understand, not to behave like the average Nigerian. No, it doesn't happen like that. Same thing as well. Okay? You go to your MD, what do you call them, your ministries, departments, and agencies, okay, and you see the way the institutions are being run, and you see what kind of the efficiency or the effectiveness of most of these institutions. Don't think that the public hospital will say, oh, we are a hospital, oh, we are not going to be like the general public sector. No, they will be like that as well. So what I'm saying is that change should happen across the board. The only painful thing in healthcare is that healthcare deals with limb and life. That's the difference.
And the doctors also took an oath. The
doctors took an oath. That's what I'm trying to say, that the doctors, there are major problems with the training of any professional in Nigeria. Any, not just the doctors or the nurses, the physiotherapists, any. They're what we call their affective skills, the ability to work in teams, the ability to provide leadership and manage things well, the ability to actually put innovation and creativity into what you're doing. You look at it and say, oh, how can we do this better? There's what I call the Phelps principle, which was actually created by me in 2015. Okay, making things faster, easier, better, safer, and simpler. We, as human beings in this part of the world, we don't think like that. Okay, and it's not surprising probably why. We have our parents who we look up to, the leaders all the way from 1960 till now.
Yes.
Okay, and that's one of the major problems that we have. So please don't expect the doctor to now jump out and say, hey, I'm going to be different from the average Nigerian. The average doctor will still be rude to you. The average doctor will still look at you and not want to give you information.
Yes.
The average doctor will still, oh, the person is dead. Oh, yes, it's dead. Oh, let's move to the next one. The average doctor, you will come, or the nurse as well. You are some because they are Nigerians. There's a particular way we behave in Nigeria.
That
but
culture.
Guess what? We are on a journey, and all that is going to change. And how does that change? It changes by, number one, providing and empowering the average Nigerian information. Information is power.
Yes, it is.
It is power.
It is.
By the time the average nurse, doctor, physiotherapist is getting people coming and say, hey, doctor, yes, sir, I need, please tell me, what are you treating me for? You want to take blood from me? Why are you taking blood? By the time they will step up. Nobody, human being, no organization, no group, no country, no state gets better without pressure. None. I didn't go to the UK and say, hey, I'm a fine boy, make me a neurosurgeon. No, I went through pressure, and that's why I'm as good as I am today. And so that means that, man, we need pressure. We need people to start stepping up and say, no, we want this kind of service.
Yes.
And I also want to mention something. When we talk about drug abuse, it also happens in the hospitals too. I had been on my visitation in one of the hospitals.
Yes.
And I bumped into a patient and a doctor, and a doctor was writing a prescription, and I asked him for what, and he said for so this thing, and I just looked inside the basket of drugs on the person's table, and I saw the same antibiotics, and I said, what you just wrote, is not the same thing here? He said, oh, sorry, I didn't know that somebody had already written that. If I did not see that, that person will be taking overdose. And that is drug abuse. That is drug misuse. And that might also send that patient to his or her early grave.
So what's the message? That everybody should be vigilant.
Everybody should be vigilant. Whether you are in the hospital, anywhere you are, you know, there is drug misuse, there is drug abuse. Do you understand? Everybody should be self-aware, you know, when it comes to your health. It's your health, it's your life.
It is your body, it's your life.
It is your body. If it goes, it goes. If you lose it, you've lost it. Okay.
Some mothers are also in the habit of giving their children antibiotics even without prescription.
Well, you see lots everywhere. You see people going into the chemist or the pharmacy shop and say, "Oh, give me 2 cards of Ampiclox," or "Give me 2 cards of."
Even trying to buy prescription drugs themselves. Even trying to buy prescription drugs themselves.
Over-the-counter drugs.
Yes.
Over-the-counter drugs. I've talked about it like 1 million times today.
Yes.
Antibiotics are not over-the-counter drugs. Sedatives are not over-the-counter drugs. The painkillers like the codeine and the tramadol, they are not over-the-counter drugs. Okay, those are not over-the-counter drugs.
They are prescription drugs.
Simple, mainly simple drugs that the side effect profile are not that bad, and you just use them for simple symptoms. Those are the kind of things you see as over-the-counter drugs, where anybody can go there and say, "Hey, I want paracetamol. Hey, I want ibuprofen. Hey, I want diclofenac." But that doesn't mean they don't have adverse effects.
Okay.
For example, if anybody takes an overdose of paracetamol, you damage your liver, and that can people can actually die from that.
Yes. Yeah.
Okay. So even though we take it as a simple drug, it's an over-the-counter drug, but still, for example, in the UK, if you go into one of the big shops, or any shop in the UK, you can't buy more than 2 packs of paracetamol. They won't allow.
Yeah.
Then, doctor, permit me to ask this question: is there any ethical rules for doctors, as in their relationship? We need more information and awareness on their relationship with their patients.
Healthcare professional, be the doctor. That's another thing. When we talk about healthcare, we're keep talking about doctors. Hey, please, Nigerians, healthcare is not just about doctors. There are nurses, physiotherapists, radiographers, medical lab scientists, pharmacists, optometrists,
lab scientists.
So every healthcare professional is fundamentally important to providing care for Nigerians and for human beings. Okay, not just the doctor. Please. You know, so I want to state that very clearly.
But it's,
and they're all important. I'm not going to talk about whether they're equally important or not. And all these healthcare professionals
they work together as a team.
Values, ethical values and stuff. But that's the problem. Even the lawyers, the different healthcare professionals, you understand, even the journalists, they have things that actually bind them and you should be professional. The code of the ethics of their work. Okay.
Yes.
But we are human beings. And
but
this is
you know, this thing happens to me. The doctor prescribed, you know, this system of computer base. They send, after the prescription, the doctor just sent the information to the lab. I went to the lab. I was like, what test am I running? He said, why didn't you ask the doctor? Just go and ask the doctor. Why are you asking me? And she was angry, as if I just slapped her or something.
Well, she was just behaving like an average Nigerian. She's a Nigerian.
Which is very wrong. You know, patients, they so much believe in you. Whatever the hospital says is the final.
But it's true. We feel the succor we're looking for, the ease, the treatment it's in you.
Honestly, for example, if I had waited for the doctors on my sister's case, several times really, if I had depended on the doctor's advice, my sister wouldn't be here by now.
Yeah.
She would have been dead.
Do
you understand? But the point is that you just have to assess the situation yourself.
Yes.
Do self-assessment. Look around. Ask questions. You can Google. Take your phone, Google.
The truth is that what is our prayer and our hope? Our prayer and our hope is that we can get to a point where you have a system, when you talk about healthcare, that actually is truly geared up for looking after Nigerians and looking after people. Okay, but
we don't have that now.
We do not have that.
We don't have that at all.
If I may talk,
remember, I've used the particular word. We are on a journey, and we will get there.
Then, if I may talk from the religious aspects of health issues, all this drug abuse. You know, Islamically, we know that the Muslims are being provided. There are some 5 objectives of the law. There's Islamic law. That's preservation of faith. After preservation of faith, then preservation of life. Because when you know your faith, I have God, He is everything, He is control, then you look at, God says we have to preserve our life. And taking this self-medication is against that, because you are actually joking with your own life. You are even as in likely to kill yourself, as in, because if you take drugs that are not prescribed for you, they are not meant for your sickness, you are actually deteriorating your health, and you know you are affecting your system yourself. And Islamically, if that really happened and it caused your death, you killed yourself.
Yeah.
And whoever killed himself,
You brought it upon
his
yourself.
punishment is something else.
Yeah.
So we have to, like, even from the religious angles, our scholars, our,
Exactly.
imams, the
Get the churches,
pastors,
the
they need
imams, get
to,
them involved.
impact
These advocacy as
this knowledge. Don't do this. And if you do it, it also have religious implications because we have that hope of paradise and as in heaven to reward for heaven. Then we need to, improve ourselves.
Yeah.
We don't kill ourselves intentionally.
Yeah.
We do things rightly.
We're pretty much out of time. We've been talking about self-medication in the conversation room. Thank you, Hawa, Dr. Douglas Chika, for coming in and throwing in so much light on the issue. Our social media handles are available on the screen. We would love to hear from you. What are your thoughts on self-medication? Please write in or send in your messages. We're here to, read your feedback and read it out on the program in the coming weeks. Thank you so much for joining us. This is Nike on behalf of the rest of the crew. Have a good day.
Thank you.